and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm really excited that you're here. And we have a great guest today. Dr. Khamir Patel is a practicing dentist and founder of SmartChair.AI, a company dedicated to automating dental practice workflows to enhance efficiency and patient care. With over 10 years in clinical dentistry, Dr. Patel has firsthand experience with the challenges of manual data entry and time tracking in dental procedures. This led him to develop SmartChair.AI, aiming to reduce errors and streamline operations in dental practices. Dr. Patel is passionate about integrating technology into healthcare and looks forward to discussing the future of dental automation on today's podcast. And I'm really excited to talk with you about this, Dr. Patel, on the podcast, because I think your bio, frankly, just doesn't do you justice. The perspective that you're bringing to automation, efficiency, and dentistry is what I think are the best ideas, which is your idea is once you hear about it, should have already existed. And secondary to that, it requires less work for the team than doing nothing at all, right? So you're actually making things easier and creating something that doesn't exist today. And not to prolong you being able to comment, but as we were talking about a little bit before, I think the reason why you hit on such a great solution with such a meaningful product is because you're a practicing dentist. So, number one, I'd love you to describe kind of what you're doing with SmartChair and how you're improving offices, and either validate or discredit the fact that this came directly out of being a practicing dentist that really knows how to run a successful practice.
Thank you so much, Dr. Laskin, for having me. I'm super excited to be here. Thank you for the comments and my introduction. I would just say this, that as we discussed before, I believe that a lot of tech products, when it comes from a dentist perspective, have a lot more value because dental offices are very unique in the way they run. There are just so many layers. There's the clinician, there's the front office staff, there are the assistants. And for me, this idea actually is one of those things, like as cliche it may sound, was a problem that we decided to solve for ourselves. So a quick rundown of where it originated. So I used to work in an office where we had 4 chairs. And my co-founder, Dimitri Burstein, who's not here today, he's the CEO of the DSO that I work for. I've been working with him since I graduated in 2014. So he's a longtime friend at this point. And there was a point in my career where the office was doing really well, and Dimitri would come in and say, Dr. Patel, let's add an associate. And my knee-jerk reaction would always be, Dimitri, if you take the chairs that I have right now, my productivity is going to go down. And that's where now, if you ask Dimitri's like, it's not about who won that argument, but it's just like thinking, and we decided that we need to ask a question. Why do we not have a solution, and how can we better understand how chairs are being used in the office? You could do it by patient management system. We have attempted it in our DSOs, and we have asked our end users as well. There's like a 40 to 50% error rate in manual entry. You are now relying on human beings, and that data set can be manipulated for different reasons. So that's where this idea was born about 2.5 years ago. Okay, how about if we are able to automate this? So that's where we now use sensors. These are pressure sensors that go underneath the chair, underneath the seat of the dental chair, and then we push this data to the cloud to help the dental practices have a better objective sense of how their biggest capital asset, the dental chair, is doing in their practice. One thing that we have done is we have kept it an extremely low-cost solution for a chair that's producing on an average $25,000-$30,000 a month. It's less than $40 a month to monitor it. So we have found so many unique ways that our current users are utilizing the data. Productivity per hour, just understanding a better sense of how patients are distributed during the day. And some instances, they have found that the last hour of the day was miraculously empty all the time. So they figured out there was something going on in the practice. And again, it's not about providing all the answers, but it's more about giving that objective data to these offices to make better decisions. And It's just something that I'm super passionate about, because I myself found that I hit a point in my career as a practicing dentist where my skill set was where it was going to be. I was very comfortable with the procedures that I was doing. I was enjoying it. I did not want to like get into super complex things. I was happy, but I figured out that looking at the time that I was taking to do different things was super important, because that was one way I was able to like tweak and be more efficient. So I started looking at different procedures and found that it was super hard to track it. So my ultimate vision with SmartChair is to give the clinicians an ability to objectively track how different things are going in their practice, better make decisions on, okay, let's implement this, take away this. So it's just super exciting times. There's so much going on in dentistry. I'm glad to be a part of this tech drive that's going on right now. But that's the whole long short of it, and love to like dive deeper into any aspects that you would like.
Well, great. So, and I think it's a really interesting solution. Again, one of those simple, low cost solutions that you can really drive value. And by the way, like I just love your perspective and the passion you're bringing to dentistry. I think that's one of the reasons why I think dentistry gets overrun by people that don't necessarily know how to run a dental practice, is because the dentists that are working so hard in their practices don't have the passion to be able to then create the next generation of innovation and elevate the profession. So I very much appreciate the extra work that has gotten you to where you are today with SmartShare. What I do want to unpack a little bit is this idea of efficiency, because I think personally that efficiency in dentistry has been viewed as a shortcut, because many times is, but what you're talking about is not that. And I feel that in my office we would do incremental change to make things faster and more systematized every single procedure, looking for what's the next thing that we could do that may just shave a little bit off. And it wasn't about making money. I like to think about it, if 60 to 80% of patients have dental anxiety, do they want to be in a chair for 20 minutes or an hour and a half, right? One way that we can really, really wow our patients is by delivering very efficient care. Not efficient care by cutting corners, but striving for efficiency through optimizing how we do our procedures. And if we do that, if we create systems to, and I've done whole courses on like how to prep teeth in less than 3 minutes.
Mhm.
And by the way, I think you can prep teeth in 3 minutes at a much higher quality than a lot of people are taking 40 minutes to prep teeth, because you actually have a plan that you're executing, right? And but what I never was able to do was track it. So what I love what you're doing is you're actually removing the emotion and have trackable elements that you're putting in the chair. So that's more of a perspective on kind of what I think you're doing. But I'd love to talk a little bit about how you view efficiency, and then how maybe a couple of use cases of how you have how your customers are using SmartChair to drive that efficiency.
So amazing perspective, and I completely agree with being able to deliver care in a more efficient way, and it takes systems. So I at this point have figured out different systems in my own practice that I want to, like, for me I schedule a crown prep for an hour start to finish. My crown prep time might be low, but starting off with the assistant going over the consent form, taking the bite, taking the shade, explaining everything to the patient. And at the end, I just have found, and people do it so many different ways, right? You have to find a system that works for you. I'll take the impression. I have an iTero, so amazing. I can see the reduction. I'm like, okay, this crown's going to fit when it comes back. And then I initially decided, okay, I'm going to have my assistants make the temps. But what I found was there was just so much time spent by the assistants, and then I had to go back to a patient and come back, and I'm like, I'm just going to make my temp. It takes me 3 minutes to do it, like zoop zoop, I'm done. I cement it and I am done. I don't have to go back to the patient at all. So things like those and being able to track time has been very important in understanding. So just to give you a real world example of how we use the data, right? So we have associates where I work, and I've been in a mentorship role where I work in the DSO. So tracking time has been super useful and making it objective. The reason why I say that is we do get a lot of fresh grads of just coming out, right? So I was a fresh grad at some point. It takes time for you to ramp up and get to where you want it to be. So we have this associate that started last summer, and my front office staff was scheduling an hour for my crown preps, and then they started scheduling her for 1 hour. What happened was it became extremely challenging when time started taking 2.5 hours to do that procedure. Not because we wanted anybody to rush or do anything faster, but it's just that we are a busy practice. We need the chairs after. So just having sitting down and having that objective conversation. Oh, I did not take 2.5 hours. I probably took an hour and a half. Now you look at the check-in and check-out data, the front office actually forgot to check the patient out. So it was an open appointment. But now we had the smart chair data in our own practice. And when we looked at it, it's like 2 hours and 20 minutes. And to our surprise, it's like, oh, now I know better. Okay, I'll be able to track my time. I'm just going to keep looking. I'm just going to try getting efficient. And then Dr. Patel, how do I get more efficient? And I'm like, okay, these are the steps that I follow. This is how I do my gingival retraction. This is how I get an accurate impression. Oh, I'm going to implement it tomorrow. And now being objectively able to track like down to an hour and a half right now, but just getting efficient. So just those things, even procedures like root canals and just making sure the patient's numb for procedures. There are so many small things that we can do in dentistry to make sure that our patients feel comfortable and efficiently complete our procedures. But getting that tracking element with that has been super helpful. And one of the key metrics that I'm super excited about is just understanding productivity per hour, because that helps benchmark. And it's about measuring yourself and just understanding how efficient you are and what are the changes that you can implement, and then slowly track. Am I getting better? Am I getting worse? How can I improve? How can I be a better dentist? Right now, as you know, dentistry is hard on our bodies. Like practicing it, it's a difficult profession physically, and just being able to enjoy what you do and be efficient along it, I don't see any downside to it.
Well, I totally agree. I have diagnosed one way that you can probably be more efficient in your practice and increase your production per hour is getting a CAD CAM system with a milling chamber, my friend, because then you'll illuminate a complete non-productive appointment. But that's a whole other talk show. I also do feel that, I've said that many times that if you want to increase the productivity in a dental practice, the average dental practice, add an operatory and replace the one person that everybody knows should be replaced, right? You touched on it earlier, this anxiety about adding an operatory. Do you have data that shows that when people add an operatory, what that does to their production, or is that not data that you've looked at yet?
So super excited to touch base on that, because again, I don't have the actual data, but working on it. The reason why I say that is one of the practices that I'm working with right now spent a big dollar amount to add another op because they converted a doctor's office. So they had to go through plumbing and construction. So I added a fifth chair. It's like, okay, Khamir, can you go ahead and add the sensor? Because we want to know how our investment is doing. What is the ROI? Last month we tracked them. The occupancy was about 22%. So they are working on implementing more protocols to see if they can make sure that the fifth chair is being utilized. So I can definitely report back to you on that and how things are going. But they appreciated the fact that now they're able to objectively track and know, okay, we've invested all this amount. What is our ROI in using that chair? So one no-brainer application of our product, and I'm super excited that we have a few practices on board doing it, is de novos, right? As you know, Doc, you have 8, 9, 10 ops plumbed, but you're not going to get 10 chairs from the first day, right? So having our product into the 4 chairs that you have right now, you don't have to then go by a gut feeling and say that, oh, let's get an order a fifth chair. Okay, this is my occupancy, this is how things are going, let's get a fifth one, let's get a sixth one. Even for multi-practice owners, that would be even huge when they're trying to expand and grow their organization. Now you don't have to, that's one decision off their chest, right? You don't have to worry about it. You can tell your office staff, let's hit this metric and we'll get another chair. So it just makes that part so efficient, and I'm super excited about that just sole application just to start off with, and then we keep building on that with so many other things: hygiene department productivity, doctor production. Like, it's just being able to objectively measure it and look at the data is huge. And there are a lot of things that we want to grow into. We're still a very young startup. There's a lot more that needs to come before it becomes a mass market product, and I'm very, very aware of that. But super excited to work with those alpha users who want to be on the cutting edge of things.
That's great. And I mean, even in an alpha product, it provides a ton of value today. And so, I mean, I would recommend for those who are listening, it's very inexpensive way to track. To my knowledge, nobody else has a really great way of tracking. So I'd urge everybody to go to SmartChair.AI. So it's spelled exactly as it sounds, SmartChair.AI. And Dr. Patel, thank you so much for being on the podcast. Appreciate it.
Yeah. Dr. Laskin, just last thought. I just wanted to touch base on you. So the AI part, and I've heard that, okay, another AI startup. So the AI solves a big problem in dental chairs is that the center of gravity keeps changing in a dental chair. So it's not a static on and off. So that's where we use machine learning algorithms to understand this was a single patient appointment. So just to touch base on that real quick, just so that if anybody had a question where the AI comes in. So just wanted to clarify.
Oh, that's great clarification. And, I think AI is a marketing term, as much as it is a real term that people leverage correctly, but that's great, a great clarification. So thank you so much.
Thank you.
Thanks.
No, yeah.
Thanks again for being on the pod.
Yeah, awesome.